So welcome to this 1 hour session. It's being recorded. Everyone who has registered for this webinar will get a link to the recorded session, and I will be sending everyone a PDF of the slides from today's session. And lastly, everyone will get a 1 hour CEU certificate that they can just type their name in and make a copy, download a copy for the records. So you'll be getting all of that today. You don't need to be emailing me saying that you didn't receive anything, because I will send it to you. Trust me, have faith, I will send it to you. If you don't receive it, please check your spam folders, because of the attachments of the certificate and the PDF of the slides. Sometimes these emails from me to you will be sent to your spam folder. So do check at the end of the day. If you haven't received a word from me, an email from me, it's likely in your spam folder. So let's go ahead and begin. I just want to thank everybody for joining us from throughout the country and abroad. This is the first time we've offered this generally. Yesterday, we tried it for the first time at a prevention conference in Washington, the prevention summit that's still going on today, the beautiful people in Washington. I think they enjoyed it. I think they learned something from it. I hope. I haven't gotten the feedback from them, so I've got my fingers crossed. And, but having said that, I think this is a good session and lots of good content. So I'm going to be going through this, lots of slides, and then at the end of today's session, we'll open it up for Q&A. So find your chat option. It's on your toolbar. Point your cursor at the toolbar. It's either in the top or the bottom of your screen. Find the option, find the chat, and then as we go along, if you have any questions, if there's anything unclear, if you have any comments related to what we're speaking about, please feel free to type it in. And then when we're done with the slides today, I'll go to those questions and those comments and take them in the order that they've been recorded. And so please do remember to respond or to add any questions. You've got the Q&A option and you've got the chat option. Excuse me, either of those will work. And I'll answer those questions. So this is your hour, your time, so use it as you wish. Interact as much as you wish. The more you interact and share, the better for you, but also for other people. So as we go along and we wrestle with this topic of implementing one session prevention plus wellness programs during the pandemic, let's stay focused on this. But of course, it is also related to all of us and our work in prevention generally during the COVID-19 pandemic and all that's going on in our country and the world. So do try to support and help each other, and that could be right here during this session. So something going wrong with you, you need help, let us know. Something you'd like that's going right that you want to share with others, please go ahead and do that as well. Okay, So here are the 4 objectives for today's session. As you can see, you'll be able to, at the end of today, describe COVID-19's effects on substance use and substance use prevention. You'll be able to review, or we will together, substance use prevention plus wellness programs. They are screening and brief interventions, and we'll also look at their contents. Thirdly, we will be identifying the unique characteristics of PPW, or prevention plus wellness programs, that allow them to be broadly implemented both in person and, even more importantly, during the pandemic remotely. Lastly, you will be able to list new adaptations to PPW programs that increase their flexibility for use during a pandemic. And we don't know how long the pandemic will continue. It's likely to be with us for quite a while. So take a deep breath. This is going to be a marathon for all of us. I just try to remember myself and share with others to try to take care of yourselves, eat well, rest, get some exercise, and do, of course, practice your social distancing and wearing your face mask to protect you and your family, your loved ones, and others you work with from contracting the virus. All right, let's first of all talk about COVID-19. And substance use. So you will be receiving, as I said, a PDF version of this. So if you're interested in this extra, these links that I'm sharing with you of this new information, you'll be able to just click on those links, or you'll be able to cut and paste them and put it in your browser and go and get more information. So for example, number one, there was a recent review article, and it identified the fact that substance use disorders may increase not just the likelihood of contracting COVID-19, but also increase the severity and even the lethality. So for example, just one small example, we do know that alcohol and tobacco use increases problems associated with flu. So we could expect similar kinds of things. And so these different types of substance use disorders, whether it be tobacco, alcohol, illicit drugs, it's likely to really exacerbate increased chances of contracting COVID and making COVID even more deadly for you, for those that we work with that have substance use disorders. Secondly, we're all experiencing probably unprecedented, at least in modern times, stress due to the pandemic. And this increases substance use and mental health problems. We've seen that throughout the country, throughout the world. And so that's an issue. So we're seeing upticks in the substance use, whether it be opioids, alcohol, et cetera. And a part of that is being driven by the stress from the pandemic and the effects on the economy, et cetera. Thirdly, we are seeing shrinking budgets, state budgets, local budgets, federal budget, or national budgets, due to the effects, direct and indirect effects of COVID-19 on the economy, which is reducing prevention services and resources. And then lastly, I know you all are very aware of number four, that providing substance use prevention services is substantially more challenging during this pandemic, because things are just constantly changing. I mean, I do trainings almost every day of the week, webinars, talking with people from throughout the country, and I'm hearing that things are still changing. Even of last week, things are changing, week by week, day by day, sometimes minute by minute, still within organizations and communities, schools and organizations, workplaces, et cetera, with regard to policy, with regard to how you can or cannot provide prevention and health services to youth, to young adults. So this is very, very challenging. I understand that, but we're all in it together, and let's see if we can help and support each other the best we can. So these are the context for us providing evidence-based prevention plus wellness programs. Let's take a look at PPW programs, that's prevention plus wellness programs, and their components. Our premier, our foundational program, our most popular program is the Sport Alcohol Drug Prevention plus Wellness program. We've got a high school, middle school, elementary school version, single session programs. This is an evidence-based program. You can learn more right here looking at this content. It's been proven to prevent alcohol, tobacco, cannabis, increased physical activity among general youth populations, as well as substance using populations. It targets, as I said, alcohol, but it's integrated with wellness. It at the same time addresses chronic disease risks by promoting physical activity, sports, healthy breakfast, nutrition, sleep, and even stress control. This is, like almost all of our programs, a single session program. It's a screening and brief intervention, very powerful program, and it is implemented with the PowerPoint slides. You have a physical manual, which has scripts in it that you follow to implement your program to youth individually, one-on-one, or in a group. We have protocols to provide it remotely, online, in different fashions, remotely. PPW programs are all based on a conceptual model, which is really a marketing model, a marketing theory, which emphasizes positive images that influence youth decision making. Sport also includes optional parent materials, a parent letter and 4 weekly flyers. It's a completely separate intervention, which is included in the sport programs. And as I said, you get a physical manual with a digital download that you copy to your favorite device for safekeeping, which includes your PowerPoint slides, all your reproducible program materials, so you could actually implement your program to countless youth or young adults. And this is a single purchase program. So the more you implement it, the cheaper it becomes. That's the sport PPW program. And then we have the parallel InShape PPW program. Again, InShape Prevention Plus Wellness. This program is for young adults, whereas sport is being implemented throughout the country, throughout the world, in just about any setting where there's young people. Children and adolescents. InShape is being implemented in colleges, community settings, even the U.S. Military. And again, very similar to sport, screening and brief intervention, primarily alcohol, tobacco focused, found to be, because it's evidence-based, proven to be effective in preventing alcohol, cannabis, drinking, driving, even a year later from that brief single session intervention. Increased physical activity, sleep, health-related quality of life. Again, targets alcohol, tobacco, while also promoting different types of physical activity, moderate and vigorous, as well as nutrition, sleep, and stress control. Single session, a little bit more content than sports, so it's a little bit longer. It can be done within an hour, maybe even a little less. You get a manual, physical manual, you get a digital download, and you have scripts to provide it in person, individually, or in a group, as well as remotely online. Then we have spin-offs, what we call evidence-informed programs. They're based on the evidence-based sport program, and they even use an evidence-based practices screening and brief intervention. All prevention plus wellness programs use an evidence-based screening and brief intervention. More about that in just a little bit. And this program, the vaping PPW program, focuses on e-cigarettes. So we created this because organizations came to us and said, hey, we love sport, it focuses on alcohol. Can you give us a sport that focuses on e-cigarette prevention? And that's the development of vaping PPW. We've got high school, middle school, elementary school versions. Again, all of our programs are evidence-based practices, screening and brief interventions, but some of our programs, sport and InShape, we've actually evaluated the programs themselves. So as you can imagine, vaping PPW focuses on preventing, avoiding e-cigarette use, again, like sport, promoting physical activity, nutrition, sleep, etc., single session intervention, etc., etc. All the same as sport. It's a spin-off or modification of sport. That's the vaping PPW program. Then similarly, we have the marijuana prevention plus wellness program. This also is an adaptation of the sport program, but obviously the focus is not on alcohol, it's on cannabis prevention, high school, middle school, elementary school versions. Again, screening, brief intervention, single session, positive image, you get a manual, you get a digital download of all your reproducible materials, you got protocols to provide it to one youth, to groups of youth, in person and online. That's the marijuana prevention plus wellness PPW program. Then we have the opioid PPW program. This is a little bit different. It's actually based on InShape because we wanted to have a little bit more emphasis on stress control, which we think is really important in the prevention of opioid use disorder. So we've got 3 versions here. In the far left, you can see that's the adolescent version, but we also have a version for high-risk young women of childbearing age, and then to the far right, high-risk young men, blue-collar type young men that are at greater risk for opioid use disorder. Again, screening, brief intervention, evidence-based practices, but the focus is on opioid. A little bit more content here. We're addressing content that SAMHSA, the Substance Abuse Mental Health Services Administration, said was important, like medication-assisted treatment, what to do in the case of an overdose of opioids. So really, really good content here in the Opioid Prevention Plus Wellness program for adolescents, young women, and young men. Other PPW programs, we've got the only multi-session program is our Sport 2 PPW program, high school, middle school, elementary school versions, whereas all other PPW programs are integrated, all the content in one session. This program, Sport 2, separates out the content into individual lessons. So for example, you've got in Sport 2 programs, you've got 3 lessons on 3 different types of physical activity, moderate, vigorous, and muscle strengthening. We got 2 lessons on nutrition and 1 lesson, a 6th lesson on stress control. So a lot of organizations, they'll implement sport, and then they'll implement some or all of Sport 2 if they want to have multiple sessions. But during our 2-hour online program implementer training, we instruct you and share with you techniques and tips to expand your single session programs, whether it's vaping, marijuana, opioid, or sport, or in shape, beyond a single session if you have the luxury and the option to see your youth or young adults more than one time. Our 2 other programs that we have to the far right, In God's Image, that's our faith-based program. It is designed to prevent alcohol, tobacco, and other drug use. It is designed to promote healthy behaviors like physical activity, nutrition, and sleep. But the difference is it also promotes spiritual practices. So this is a great program for faith-based settings. So that's why we created it for church and other faith-based settings. And it does focus on promoting spiritual practices, reading scripture, helping others, etc. To the left is our most recent PPW program. It's very unique, Racial Justice Prevention Plus Wellness. We do know research shows that racial discrimination increases the risk for young people to get engaged in substance use, depression, other mental health problems, school failure. So in other words, racial discrimination or racism is a social environmental risk factor for youth for substance use. That's why we created Racial Justice PPW. Great program, very unique. It addresses substance use indirectly by promoting racial justice behaviors or anti-racism behaviors, positive behaviors that increase personal development, but also can increase racial justice throughout a school and community setting. That's Racial Justice Prevention Plus Wellness. That program, like our other programs, includes a physical manual and digital downloads. The In God's Image, by the way, is our only program that's completely online digital. So you just get the whole program and you can make copies of anything you want. All right, now let's talk about the unique characteristics of Prevention Plus Wellness programs and how these unique characteristics allow them to be implemented widely so that you can have a true public health effect of your program versus, let's say, a multi-session program that's 6 or 10 or 12 or 20 sessions in length. So here are some of the advantages starting in the top left. PPW programs address not just substance use, but chronic disease risk behaviors and other risks. So they're integrated, they're broader in nature. And for that reason, they could be actually more positive. I'll show you how. PPW programs are single session programs. For the most part, they permit broad public health reach because they can be implemented so quickly in even the most challenging settings, the most busy settings, and even online. Off to the right, PPW programs use an evidence-based screening and brief intervention practices model that I mentioned already, and I'll tell you more about that model. PPW programs are based on positive image and behavior marketing theory. The theory is called behavior image model, and I'll describe that for you today. PPW programs use multi-behavior goal setting. You might see goal setting in other prevention programs. The goals would be to, maybe prevent or pledge to avoid substance use, but the difference is that Prevention Plus Wellness programs also are designed to set goals to increase protective wellness behaviors. So that's why they're multi-behavior goal setting. PPW programs promote habits, improving both physical and mental health. How does that work? I'll share with you that information in a moment. PPW programs use scripted content. What's the advantage of that? It increases fidelity and ease of providing your program. It also reduces training time. PPW programs are easily tailored, while other evidence-based programs may say, hey, you can't tailor your program. You've got to use it exactly the way we created it in our research studies. We say that you can tailor your program if you have a unique population or setting. The question is, it's sort of a balance. The question is how you tailor it, which could actually increase its feasibility and efficacy, but not interfere with the underlying conceptual and practices model. We promote that, and we can help you tailor your program if you feel that's necessary, and it's not very difficult to do. PPW programs use scripts, and you can provide your program to youth individually or in a group. And that could be general populations or high-risk populations. So you can use these programs as universal as well as selective and indicated prevention for high-risk youth, such as, for example, substance using youth. PPW programs include built-in immediate pre-post surveys and free analysis from us. So this is really, I think, a game changer. This may be the first time you as a prevention specialist can actually find out and monitor how well you and your program are doing with your youth, because it's focused right then and there on a pre-test before the lesson, post-test at the end of the lesson, allowing you to assess how your lessons are working with your youth, and even in the words of your participating youth themselves, because you collect both quantitative and qualitative data in that. PPW programs include program manuals and digital downloads and online resources that allow you to extend, expand, and enhance and sustain your program over time. I'll show you all of that today. So let's take a look at first how PPW programs address not just substance use, but chronic disease risks, that's CDR, risk behaviors, and other risk behaviors. So if you look to the right, obviously prevention plus wellness programs address substance use, whether it's alcohol, cannabis, opioids, tobacco, vaping, etc. Also, under number 2, chronic disease risks are addressed. How? Under 2A, obesity is addressed, screen time, physical inactivity, all of that is addressed in prevention plus wellness programs by promoting different types of physical activity, including sports. B, another chronic disease risk is increasing the awareness of environmental influences for sedentary living. That includes particularly friends and family. And this is addressed especially within the high school versions of prevention plus wellness programs like sport. 2C, unhealthy nutrition is addressed by promoting healthy breakfast and other healthy foods, particularly fruits and vegetables. 2D, lack of sleep is addressed by promoting 8 or more hours of sleep. And lastly, E is addressed by promoting relaxation and other strategies to control stress. Lastly, number 3, other health risk behaviors are addressed in our specialized programs. In God's Image addresses lack of spirituality, which is a risk factor for substance use. And 3B, racial discrimination is addressed in our racial justice prevention plus wellness program, which I had already mentioned is a risk factor for substance use among youth. Prevention plus wellness programs are, for the most part, single session motivational screening and brief interventions. Screening and brief interventions, as I mentioned, are evidence-based practices. They motivate behavior. They're designed to focus on initiating and maintaining behavioral change. So there's more focus on motivating changing behavior than on education. There was a review of the effectiveness of screening and brief interventions. This is multiple studies reviewed back in 2015 by Tanner Smith and others, and Lipsy. And they showed that screening and brief interventions are effective up to a year after that after those brief interventions for adolescents and young adults. And if these screening and brief interventions had used goal setting, they were even more effective. They were especially effective. Number 4, prevention plus wellness program studies of screening and brief interventions, that is, screening and brief interventions that are prevention plus wellness programs, were there was some evidence there showing that both sport and in shape were effective. Some effects were even in place a year after the brief interventions. There was a review article by Ken Winters in 2016, and he highlighted the fact that brief interventions hold great promise for really expanding services to a wider range of youth. Why? Because of their brevity and because of their applicability to young people and in multiple different settings. Number 6, efficacy and brevity allow, I guess I've said this before, public health reach and impacts. And lastly, screening and brief interventions are practical for in-person use as well as online use when you compare it to more complicated and less feasible multi-session prevention programs. Prevention plus wellness programs are implemented in all 50 states and abroad in just about any setting where you could think of where there are youth or young adults, from colleges and military to schools, in school, out of school, after school, school sports, juvenile justice, recreation, wilderness, YMCAs, Boys and Girls Club, on and on and on. Wherever there's youth, prevention plus wellness programs have been and can be implemented. Now, I said this before, screening and brief interventions, SBIs, are considered evidence-based practices by a number of national and international organizations, including SAMHSA, the Substance Abuse Mental Health Services Administration. In fact, they've created their own screening and brief intervention called SBIRT or SPIRT, that's screening, brief intervention, and referral to treatment. The Centers for Disease Control Prevention supports alcohol screening and brief intervention in primary care settings. The World Health Organization supports alcohol screening and brief intervention. The National Institute on Alcohol Abuse and Alcoholism supports alcohol screening and brief intervention for youth. The American Academy of Pediatrics supports SBIRT for youth. And lastly, the National Institute on Drug Abuse supports adolescent substance use screening for screening and brief intervention. The screening and brief intervention model used in prevention plus wellness programs is a 3-step model. First step, screen youth for their current health habits, not just substance use, but also wellness behaviors. This increases awareness of their health habits and their lifestyle. Secondly, provide feedback about each of those behaviors, and you use positive image communication about desired future selves and of their peers engaged in the wellness behaviors, how substance use interferes with that. That increases motivation for change. And then thirdly, capitalizing on that and initiating behavior change, walking young people through goal setting to avoid substance use, to increase protective wellness behaviors. And over time, this increases self-regulation skills or self-control skills. We teach youth to shape their own behaviors, and youth desperately need self-control, and particularly high-risk youth. Now, the conceptual model that I had mentioned before that underpins all prevention plus wellness programs, this marketing-related positive image theory, is called the behavior image model, BIM. It's a marketing-related theoretical roadmap, if you will, for creating brief or non-brief even interventions that connect or that link positive wellness behavior promotion with substance use prevention or avoidance. There's 2 components to the behavior image model. The first is the assumption that you could use these positive image communications and that will increase their motivation for change. And then secondly, you could use multiple behavior goal setting to increase self-control of skills of young people. Let's take the first part of that model. What is the evidence for the effectiveness or the efficacy of positive images and behaviors? Well, there's 3 sources of evidence for using images for targeting images in prevention, health, public health, medical communications. First, image has a conceptual or theoretical basis or support. For example, if you look at positive selves theory, you'll see that that's the whole focus is on using images that can help elicit again, a desired future self or feared self, and this drives decision making in young people. But there are many other theories, Bandura's social cognitive theory and others that support images theoretically as very important in the decision making youth use to use or not use substances and to engage or not engage in other wellness behaviors. Secondly, there's plenty of research that supports images in decision making of youth. Just look, do your own search on the heading of self-concept, prototype images, possible selves, and even a positive identity. You'll see research supporting this idea that images of young people, images that young people have of themselves in the future, of the peers, influences their choices, their health choices. Thirdly, there have been decades of practical experience in marketing and advertising in the world's largest companies, and the focus that they use even continue today as an effective strategy is using appealing images, because appealing images influence purchasing behavior. Look at the example to the left. Are we having blank yet? There's an example of a company selling beer. How are they doing it? They have, look at the images, appealing, healthy, happy, socializing young men and women. That's how they're selling. They're not selling using negative images. They're not selling not using images. Positive images have a tremendous impact on the purchasing behavior. We're not selling anything other than a healthy lifestyle. And so you can use positive images to influence healthy lifestyle decisions of youth. Lastly, the focus on positive wellness habits is a very, very effective strategy because that increases acceptability and interest in participating in prevention programs, not just by youth, but by parents, by providers, by organizations, by schools, communities, etc. So the focus on positive behaviors and images, and again, these wellness behaviors and images, that's much more appealing, especially to older adolescents and to young adults, than just risk messages that they would likely have heard when they were younger. So that's the efficacy of positive images and behaviors. Now, how about that second part of the behavior image model that focuses on multi-behavior goal setting? A few points just to raise here. Goal setting, research shows, is effective in initiating and maintaining behavior change. Goal setting, very, very important. Just think about effective entrepreneurs. Think about effective and successful athletes. They set goals and they reach goals, and that shapes their behavior and increases their success. Setting and monitoring goals increases self-regulation or self-control skills over time, where you can learn to shape their own behaviors. Goals are set to focus on achieving a desired future image of themselves, being more fit, active, healthy, successful. And these goals end up are essentially values for youth. And if they value them, then they'll set goals that will increase their motivation, and they'll set goals to change those. Behavior image goals are multi-behavior, avoiding substance use, and increasing protective wellness behaviors, and all prevention plus wellness behavior goals are aimed at also identifying someone to co-sign the goals or to have young people share their goals, and that research shows will increase motivational strength in goal setting. Now, I'm sure many of you are aware of this slide or a content similar to this. This is from the National Youth Risk Behavior Survey data, 2017, percentage of ever using these substances. These are high school adolescents throughout the country. And you know that you can see, and these are substances that are addressed in prevention plus wellness programs and other substance use prevention programs. You can see the priority, what it should be in your prevention efforts. 6 out of 10 high school adolescents have used alcohol sometime in their lives. That's followed by over 4 in 10 having vaped e-cigarettes, and that's followed by using marijuana, more than a third, and that's followed by cigarettes and opioids. So those are your substances, and there are obviously other substances, other addictions that can be addressed in prevention programs. But don't forget there are these other chronic disease risk factors, risk behaviors that influence, that also affect and will affect over time the health and well-being of young people and can interact, I'll show you how, with these substance use behaviors. So what are some of the chronic disease risks? What are the percentage of those engaged in these behaviors? Well, you see 3 out of 4 young people, high school students throughout the country are not getting 8 or more hours of sleep, and they're not getting 7 days, a full week of physical activity. That's the minimum 60 minutes every day of the week. 3 out of 4 are not eating a healthy breakfast. And look at this, less than 40% are eating even 3 vegetables a day. And so these are some of the chronic disease risks happening at the same time. Another way to look at this is to take a look at, there's a number of these reviews of research, but this one is one of the more recent ones done in 2016 by De Winter and others that looked at longitudinally over time, which really helps indicate, I think, the relationships between risk behaviors. And this study looked at patterns of health risk behaviors among high school adolescents, and they found, and they were examining multiple health risk behaviors, and they found them very common among American adolescents. And in fact, about 4.2%, less than 4.2% met all 8 behavior guidelines. So very, very few were following all the health behavior guidelines. And over 10% had 5 or more of 8 risk behaviors by age 16, meaning that it's likely going to increase to 18 and 21 more and more. In other words, you're having a significant number of young people having multiple risks. Also, this research showed that youth that don't eat fruits or vegetables, don't eat breakfast, are overweight or obese, physically inactive or smoke, those behaviors predicted other health risk behaviors. So what did the researchers conclude? What did they recommend? Prevention targeting multiple risk behaviors is needed. So that's the whole focus, focusing on integrated programs that address multiple risk behaviors. Here's another way to look at this in terms of, what are the effects of these integrated programs like prevention plus wellness programs that address not just substance use, but chronic disease risk behaviors. What does that have to do? Obviously, it has to do with physical health. What does it have to do with mental health? Let's take a look at it by looking at sadness and hopelessness as a proxy measure for mental health. And let's look at that in relation to wellness behavior. So here we got a health behavior, 60 minutes physical activity, 5 days a week. And we're doing a crosstab or a correlation with this with feeling sad or hopeless. Look at the relationship, highly significant. And if you look at those getting physical activity, you got 27% reporting feeling sad or hopeless. Those not getting physical activity, quite a bit more, 35% reporting sadness and hopelessness, which is again an indicator, a measure of mental health problems. So we see a relationship with physical activity, more physical activity, less mental health problems as measured by sadness and hopelessness. Same relationship with eating breakfast every day of the week. Those eating breakfast, 22% had sadness and hopelessness, whereas those not eating breakfast, a full 30, almost 37% felt sad or hopeless, and that highly, highly significant. And thirdly, another very significant relationship between wellness behavior and sadness, hopelessness, 8 or more hours of sleep. Those getting sleep, 21% felt sad or hopeless, 35% felt sad or hopeless for those that weren't getting sleep. So you see that relationship between wellness behaviors and mental health. Another way to look at it are looking at the benefits of a healthy lifestyle. According to research, healthy lifestyle being physically active, getting plenty of sleep, eating nutritiously. This kind of a lifestyle is associated with less depression and anxiety, less unsafe sex, and for those of us who are prevention specialists, less alcohol, tobacco, and illicit drug use. Also, healthy lifestyles associated with these other benefits: improve physical and mental health and self-reported quality of life, more positive self-image, self-esteem, self-regulation, self-control, greater brain development, cognitive functioning, more opportunities to make friends and socialize, greater academic success. Yes, healthy lifestyles associated with greater academic success as measured by less suspensions, greater school attendance, less dropouts, and greater likelihood to attend and complete college. And of course, as you'd expect, a healthy lifestyle is associated with less chronic disease. And these are types of chronic disease: heart disease, diabetes, stroke, cancer, obesity, osteoporosis. Lots of positive outcomes associated with a healthy lifestyle. How do we know multiple risk behavior integrated prevention plus wellness programs are effective? There's been a number of reviews that have supported this. Here is one of the more recent ones by A.J. Simonton and others in 2018 that showed decreased adolescent substance use was associated with one-time multi-health consultations and group sessions. And so they recommended that school-based interventions should target multiple health risk behaviors, and that these could be effective and efficient way to decrease youth substance use. That was a review of research. Now, prevention plus wellness programs that I had mentioned earlier use a scripted content. You can see the advantage of that: ease of use, less training time, increases fidelity and reliability, and allows skilled implementers like even youth to provide prevention plus wellness programs. You don't have to have any specialized training or experience because the programs are scripted. You read the script, you follow the script, you practice it. It does require practicing, and it does require that you have the script in hand. We promote tailoring when necessary, tailoring to the needs of your youth or young adult population or setting. Program tailoring is encouraged if needed. Simple to do. You take your PowerPoint slides. One example of this is Montana youth. There have been some organizations, I think some schools in Montana, that switched out some of the slides of our prevention plus wellness programs and put in images of a youth, Montana youth, engaged in outdoor activities, because there's many more outdoor activities in their region. That's a perfect example of how you can customize your prevention plus wellness program. Slide content can be increased or expanded. The U.S. military, Air Force increased the in-shape content by having a little extra content on the risks of high caffeinated drinks, which were deemed a particular problem on their bases. And another example is one of our other prevention plus wellness providers added a slide on SMART goals. SMART is an acronym for goal setting, and they added a slide, so a little extra content. That's how you could add extra content. That's within prevention plus wellness programs in the slides. Slides and other materials can be co-branded as well. You could have your logo, that's the more common thing, logos and colors and so on. Any tailoring that you do of any of our materials, whether they're the slides or other materials, should be sent to us first for approval, review approval. We'll provide you feedback. And if you're doing something that we think is a really great idea, we'll share it with others on our social media and on our website. The scripts that you receive in your prevention plus wellness programs, usually you'll receive a script to provide your program to youth or young adults individually and a group. It allows that flexibility. Both scripts, individual and group script, use the same slide, so it's very easy to flip back and forth from an individual script to a group script. The individual script permits personalizing feedback to that individual youth. This may increase the efficacy of the program because there is a certain amount of research showing tailoring improves program effectiveness, message reception, and effectiveness. However, the group script certainly increases efficiency. So you have a group, and you can cover more youth or young adults, obviously, in a shorter period of time when you have a group. So that's why you have that flexibility. You've got a script for individual, youth, young adults, and group individuals, group, youth, or young adults. Both scripts can be used across, are being used across the United States as universal, selective, and indicated prevention. We have built-in pre-post evaluation. This includes a scannable pre-test, post-test survey. This allows immediate focused program evaluation so you can monitor the effectiveness of your program. It includes 2 measures highly predictive of future behavior. It also includes 2 qualitative measures which help inform the quantitative measures. It provides data for both promoting and improving your program. And we also provide a free basic analysis of your scanned surveys. In addition, under number 7, we also have links to online surveys. So if you provide any of your PPW programs online, you actually have, instead of the scannable forms, you have a link to SurveyMonkey forms, and you can easily collect your pre-test and process during your online session with your youth or your young adult. So it's a great thing. Don't even have to touch the data. The data are being collected for you by the links, by the SurveyMonkey system. Program manual and digital downloads. The manuals include, as you can see there under number 1, directions, scripts, evaluation tools, online protocols, parent flyers, and the sport programs. And the downloads include your PowerPoint slides and all reproducible materials. We also have a bunch of online resources. Let me just go through them with you. We've got PPW program promotional resources. So a lot of organizations and professionals want to promote their program to others, to youth, to parents, to organizations, their community funding agencies. That's why we've got a whole page on our website, preventionpluswellness.com. Go to tools, that's TOOLS, and you'll find all of these free resources. I'll say it again, preventionpluswellness.com. Go to tools on the top of our homepage, and you'll see a drop-down menu of all of these, including these tools to promote your program. A fact sheet, colorful brochures about all of our programs, an 8-minute video on the 3 steps for providing PPW programs, program menu to help you gain approval to provide your program in schools and other settings, participating youth certificates, posters and banners, and even a Prevention Plus Wellness lifestyle logo. Healthy lifestyle guidelines. This is very popular. We've just expanded this. This is evidence-based information, guidelines and resources for goal setting for youth. We got guidelines for youth, children and adolescents, as well as for young adults and adults in these 7 areas. And we continue to expand this. I think we'll have a webinar shortly on this topic. We also have PPW youth and teacher resources. These are web-based resources. This helps you extend, expand, enhance, and sustain your PPW program. It's evidence-informed information and content for youth, for professionals like yourselves / parents, so you could share it with other teachers, coaches, parents. And then there's content for youth directly for them, includes videos and games and quizzes and blogs, etc. And youth assignments. You can give youth assignments to extend or expand your PPW program, lesson within the lesson or out of the lesson. And these are the topics under number 5. Physical activity, health, eating, sleep, stress, all of those topics. You have plenty of web-based resources in all of those topics. We offer weekly PPW webinars. If you haven't gone to our website and dropped in your email, do so today so you can get notifications of our weekly webinars like this one today. It's preventionpluswellness.com, and these are some of the more regular webinars that we offer. We offer most of these webinars every 3 weeks. We rotate them, and we try to add new webinars as well. Something brand new to Prevention Plus Wellness is a substance use Prevention Plus Wellness program providers Facebook group. So this is for substance use prevention and wellness professionals. It allows you as a professional to network and discuss problems and solutions and successes with providing Prevention Plus Wellness programs in the US and throughout the world. We created this because in one of our recent webinars, a whole bunch of people said we need to have a way to network with others. So we created this. We'll see how it works. And you could sign up. You could sign up by just searching in Facebook for Substance Use Prevention Plus Wellness Program Providers. You can also go to our website, preventionpluswellness.com, drop your email in there, and you'll get notifications of our free webinars and resources. New Prevention Plus Wellness Program adaptations have been created since, I would say, March, April, because of the pandemic. These include remote online program implementer protocols, free on our website so you can know how you can present your PPW program to youth remotely. A free training webinar, a recorded webinar. We offer it live every couple, 3 weeks. Updated program, PPW program slides that increase student interaction, which is so important when you present your lesson online, and online assessment tools. Let's take a look at them. The protocols, the online protocols are in these 5 areas, step-by-step directions. So you can implement your Prevention Plus Wellness program to youth individually online, to groups of youth online, in a combined or hybrid in-person and online format, as well as recording and by telephone. These are step-by-step protocols on our website that walk you through how to provide remotely in all these 5 different scenarios. We have free training webinars on how to provide a Prevention Plus Wellness program, a free training webinar on how to provide Prevention Plus Wellness programs online. Here are the objectives of that training. There's the recorded version. We do provide this every couple, 3 weeks live and update it. And there's even the online strategies slides you can look at. All of this is on our website under tools. That's preventionpluswellness.com. We also have updated all Prevention Plus Wellness program slides. There's discussion questions that are included. Two reasons for this. One, or be 1A, is to increase participation among youth, which is really important when you present a lesson to a group of youth in person or online. And B, it enhances participant reflection on their own lifestyles. This helps increase motivation for change. Secondly, we have screening, survey, and goal plan slides, which permit you to implement your PPW program online. We also have this customized online pre-post survey. It measures behavioral intentions and perceived harmfulness. These are some of the best predictors of future behavior. These measures include 5 substance use behaviors, not just 1 measure, but 5, 4 measures of wellness behaviors, and we could send your organization a customized link so your data will be kept separate from everybody else's. We also have a link for the instructor survey. This instructor survey is a process measure. Every time you implement a PPW program, or at least every week, you should take this instructor survey. We even have an online version of it in addition to a hard copy version, and it measures 7 critical indicators of quality presentation, comfort level, active presenting, enthusiasm, etc. We have training, online training, making it very easy and convenient for you during the pandemic. We've got a 2-hour online program implementer training. That's $199 per trainee. 2-hour online train the trainer, and a 1-hour youth leadership training to train youth to provide Prevention Plus Wellness programs. So let me just conclude what we've covered today. We've covered a lot. Number 1, COVID-19 has negatively impacted substance use prevention by reducing the availability of prevention funds and services, increasing challenges that you all know are experiencing because of the constant changing of our environment. Secondly, PPW programs include evidence-based and evidence-informed single-session programs for youth, for young adults, addressing all different types of substances and promoting protective wellness behaviors. 3, PPW programs have multiple unique characteristics that allow them to be widely and broadly implemented in person as well as online. And recent adaptations allow PPW programs to be even more easily and widely implemented during the pandemic. There's our website. Check it out, preventionpluswellness.com. There's even a link on our website for a catalog, an online catalog of our most common items. There's a link if you want to request a sample, an e-sample of one of our programs. Go to preventionpluswellness.com. Feel free to call us at 904-472-5022 here in St. Augustine, Florida, or email us at info@preventionpluswellness.com. All right, thank you so much. I've covered it. Let me see if you have any questions. I'm going to look at the Q&A and at the chat. Now is your opportunity to ask any questions for clarification, make any statements, any comments. An anonymous attendee said, is the online survey analysis free as well? Yes, we can do that for you, or we could simply send you the results in SurveyMonkey, the pre-test and the post-test. But yes, we can put it together and we can do a little review, if you will, or highlight what's working, what's not working, which will inform you and also help us understand how things are going with different organizations. We're happy to do that. That all depends on our workload and the number of requests we have at any one time. But we definitely try to provide that free service to our providers. Thank you. Okay, that's good. Perfect session. Thank you. Love the positive communication. We do have a couple minutes yet. If anybody has any questions, any comments, remember, I will send out to everyone who's registered today a link to this recorded session. I will send you a certificate of completion, 1 hour certificate of completion. I will send you the PDF of the slides. And so just look at your email. If you don't get it, check your spam folder. It's likely have been sent there. I'll be doing that shortly at the end of today's session. So just look for that, if you will. There's one more chat note. Let me see what it is. It's just another thank you. Thank you, guys. God bless you all for what you do. Keep up the good work. Do please take care of yourself, protect yourself, take care of your health. And if there's anything we could do here at Prevention Plus Wellness, let us know. We'd be happy to partner with you to make a difference in the lives of youth and families where you live, in your region, your state, your nation. And thank you so much for everything that you do. And have a wonderful afternoon. Thanks, everybody. Bye-bye.